Well, tinnitus is an abnormal perception of sound. People hear something that, isn't there.
Dr. Kenneth Scott from Midwest ENT and Allergy in Sioux Falls helps patients deal with tinnitus. The most common symptom is constant ringing in the ears.
It's sort of like a sound like crickets or a constant sort of ringing sound, they'll sometimes describe it, or a whooshing. Every once in a while, you're hearing yourself, you're hearing the blood vessels inside your neck or your head, so that can be a slightly different sound, but the usual kind is the ringing.
Dr. Scott says 90% of people will get tinnitus in their lifetime, and it can be a side effect of certain medications rather than a cause. Most people will get tinnitus when experiencing hearing loss.
Most commonly, it's your brain wishing you could hear better, and the bottom part of the brain kicking in filler sound or filling electrical signal that the brain then perceives as a background ringing.
He says tinnitus mainly affects people over 50. However, people exposed to loud noises throughout their life, like farmers, are more at risk than others.
So if they're farmers, even when you were doing your farming when you were more of a kid, sort of taking it all for granted, in terms of the loud sounds, you can start getting troubles earlier.
When checking for tinnitus, Dr. Scott uses an audiogram, which measures how well you can hear quiet sounds.
It is beeps, different pitch beeps, so they can tell what pitches you're having trouble hearing, and they also measure how clear your hearing is. So they'll read you words and they'll try to see if you can understand the words.
Dr. Scott says hearing aids can help soothe tinnitus because they replace what the brain wishes to hear, and says newer hearing aids help fix it.
There's some new technology within hearing aids where they can provide a little bit of a sort of a masking sound at the area of the ringing, and it can kind of soothe, almost like a baby being soothed by having a noise generator in their crib when they're trying to sleep.
Protecting your hearing is important, and Dr. Scott ends with saying wearing ear protection in any loud environments will help preserve your hearing and help protect against tinnitus.
Sometimes people will say use both, put in the squishy earplugs and then wear muffs as well, but something's better than nothing, and so I personally just wear the squishy little plugs.